So we got the iliopsoas group we're working on next, and that's going to be the end of it. So these are your deep hip flexors. They're the most prominent muscles for flexing your hip. The psoas major is the one I'm going to talk about first. There it is. Attaching at the lumbar vertebrae on the anterior aspect of the lumbar spine. So the bodies and the transverse processes. So it's deep inside your core. The way that we access that muscle is to go in through the abdomen to massage it. I've done it many times, and it's not something to be afraid of. You just need to be properly trained. It comes down and attaches to the lesser trochanter of the femur. And its actions are lateral lumbar flexion. So you can do like lateral flexion. You can do hip extension, you could do lateral lumbar flexion, which is like a tilt to the side. There's hip flexion. There's lateral rotation of the hip, which is it pulls the leg outward. It does anterior pelvic tilt when they are working. It can do that unilaterally or bilaterally. It's a big culprit with anterior pelvic tilt, with tilting the bowl toward the front, toward the anterior side. Especially when it's bilateral, but it can do it on one side, and it can cause the glute to stick out on one side. So sometimes when you have somebody laying prone on the table and you notice one hip is higher than one side of the hip is higher, or one glute is higher than the other, it can be because one of the psoas muscles is shorter or more tense than the other. So it causes that pelvic tilt on one side. And with the leg insertion fixed, so instead of the origin being up on the lumbar vertebrae, if the origin pretends that it's down on that leg insertion, it helps with trunk flexion. It helps you to be able to do crunches. And then we have psoas minor, which a lot of people don't have, actually. Like about 50% of the population has psoas minor. It's interesting to know. It's this little bitty muscle that goes from T12. It attaches at T12 and lumbar 1, and it comes down and attaches to the pubic bone, the superior ramus of the pubic bone, and it helps with pelvic tilt and trunk flexion, and it causes hyperlordosis. That's one of the things it causes.